I call the Minister, Lord Bethell.
My Lords, this government is committed to providing the best possible care for children and young people accessing gender identity services. Earlier this year, the National Institute for Health and Care Excellence was asked by NHS England to undertake a thorough review of the latest clinical evidence on the use of puberty suppressants and cross-sex hormones. An independent group under the chairmanship of Dr. Hilary Cass will make recommendations about the existing clinical policies based on this evidence.
Green.
My Lord, I wish to make my position clear. I am opposed to all forms of transphobia and transgender discrimination, but this should not override the rights of women as defined in law. I welcome the Noble Lord, the Minister's statement in relation to both the guidance and the research. But I'm sure my Noble Lord agrees with me that the importance of the NHS guidance, but does he also recognise that this needs to be supported? So what actions will the government take to ensure that local services such as CAMS are sufficiently resourced to provide psychological support to all children and young people with gender-related distress?
Well, my Lords, the Noble Lord puts his point extremely well, and can I share with him the concern and the concern of those who have trans or gender concerns of any kind at all. And can I reassure the Noble Lord that the provision of services at all levels of the NHS for those seeking gender identity services is absolutely a priority for the NHS. In this recent court case, what we've seen is a clarification of some of the guidelines that are attributed to some of those services, but it in no way mitigates against or suggests a lack of commitment by the NHS for these kinds of services.
Nicholson of Winterbourne.
Would the Noble Minister confirm that since no baby can be born in the wrong body, and since human sex cannot be changed post-birth, that extensive plastic surgery, castration, double mastectomies, and the concomitant lifetime of heavy unnatural drug usage following puberty blocker introduction is not the right way to assist a troubled child to gain mental stability and a contented and healthy future?
Well, can I reassure my noble friend that people with gender dysphoria cannot access gender reassignment surgery under the age of 18. So young people are not eligible for this type of procedure that the Noble Baroness is describing. Gender identity services is a clinically led service that focuses on enabling the young person to choose the path which suits their needs. The service supports children to explore their feelings, recognising that there isn't a one-size-fits-all approach. This seems an appropriate approach under the circumstances.
Baroness Fox of Buckley.
My Lords, I warmly welcome the court ruling that children cannot consent to treatment to suspend puberty. Will the Noble Lord, Lord Bethell, join me in saluting the bravery of Kira Bell for taking this action and echo her message that being a tomboy or not liking stereotypically girly things does not make girls or young women any less female? But crucially, will my Noble Lord clarify that this ruling does not undermine the 1985 Gillick judgment, giving young women the legal right to reproductive health care without parental consent, and that this false and scaremongering misinformation being circulated by certain organisations, including Amnesty International and Mermaids, is actually driven by a particular agenda rather than a concern for transgender people's rights?
Well, my Lords, I would like to take the opportunity to salute the court, who have, in a thoughtful and lengthy judgment, brought enormous clarity to an area that is very, very important, but also one that has caused concern and ambiguity. The court has made it clear that children under a certain age are not ordinarily able to make the kinds of decisions that have been previously asked of them. But there are openings, so no one under the age of 16 can now be referred onto puberty blockers unless a court rules that it is in the children's best interest. These are helpful clarifications, and we look forward to further work to clarify this area.
Baroness Wheeler.
My Lords, the mental health and well-being of young children and teenagers who present with gender dysphoria is paramount. Given the NHS England announcement on puberty blockers, what support is the government giving to those children and teenagers affected by the revised guidelines and their families and schools? And on medical matters, will a young person under age 16 concerned about gender dysphoria who approaches a GP, for example, continue to be covered by the duty of doctor-patient confidentiality?
Yes, well, I would like to first of all reassure the noble Baroness that patient-doctor confidentiality remains paramount and is respected, as she suggests. To update the noble Baroness, the Tavistock have immediately suspended new referrals for puberty blockers and cross-sex hormones for the under-16s, which in future will only be permitted where a court specifically authorises it. But can I reassure the noble Baroness that those who are already on the programme will continue their medication until the review has been finalised.
Baroness Barker.
The legal team which brought the recent case has brought several cases over the years designed to oppose LGBT rights and to restrict the reproductive rights of women and girls. So all of those actions are consistent with campaigns run by organisations including the Heritage Foundation and the Alliance Defending Freedom, extreme evangelical right-wing American organisations. Will the Minister tell the House which NHS England boards or committees approved the amendment of the Gender Identity Service specification on December the 1st, prior to the court requiring it to do so, and in the light of the fact that this judgment can and will be appealed? And if he doesn't have that information now, can he write to me?
Well, my Lords, it isn't appropriate for me to comment on those who brought these cases. And there are existing and outstanding judicial proceedings in place at the moment. So it's not possible for me to comment from the dispatch box in response to the Baroness's remarks. All I can say is that the NHS, NICE, the Tavistock, all have the interests of patients at their heart. We are not ideological about that. We are absolutely committed to the best interests of patients. And I'd be glad to write to the noble Baroness to answer in any way I can the answers that she's posited, the questions that she's posited.
Gale.
Is the Minister aware that the ruling and the NHS England response to it has caused significant uncertainty and distress amongst young people and families currently supported by the Tavistock Clinic and those on their waiting list? So can the Minister say what steps the government is taking to ensure continuation of care for young people currently in the care of the Tavistock, who is affected by the NHS England response to the court ruling?
I'm sure that her testimony is entirely right, and it concerns me that anyone has any concerns in this matter. But can I reassure her that the Tavistock is doing absolutely all it can to reassure current patients and those who are on the referral list? Its communications have been excellent throughout. The provision of beta blocker of gender blocker services to the existing patients has continued, and they remain in close contact with those patients as the review plays out.
Or Dobbs.
My Lords, I hope this is an appropriate moment to reflect on the life of Jan Morris, that glorious writer who died just over 2 weeks ago. She was born a man, served in the British Army fathered 4 children with her beloved wife Elizabeth, and then transitioned from male to female in the 1970s, a challenge she bore with extraordinary humour and patience. So may I recommend that my noble friend read all her books in his spare time? And would he agree that Jan Morris's example of seeing the world in glorious colours rather than narrowly in black and white, and of always showing kindness and tolerance, even to those who disagreed and perhaps disapproved of her, is an example that should inspire all sides of this debate and give comfort to those, particularly children and their parents, who find themselves struggling with the same difficult situation she did.
My lords,
to be more affected by their warmth and kindness. Jan was an absolute model of warmth and kindness. Can I also say that having worked in the nightclub industry, I've met and worked with and enjoyed the company of many trans people, and that has always proved to be an extremely uplifting experience. And I am a